Today we're happy to have with us Jean Lyon. She has 29 years of experience as a nurse practitioner, and she currently works at COE-NF as an infection prevention specialist. She's also a board certified psychiatric mental health nurse practitioner, and she has a doctorate in nursing. We appreciate Jean joining us today, and I'm going to turn it over to her. And during the presentation, we would ask that you put your questions in chat or raise your hand. Jean will not be taking questions during the presentation. Jean?
Okay, thank you, Sarah. All right, everyone, welcome. And it's good to see everybody. I've been to, I think, every one of your states. Perhaps I surveyed. I know I did some kind of a survey at Providence in Anchorage. So I hope it was a positive experience if you were there at the time. Today, we're going to talk about screening for mental health and substance use. And I'm going to go over a tool for each of these areas that you can use when performing mental health exams for people if you think they may have anxiety, depression, and then we're going to also talk about substance use. Let's go to the next slide. Okay, last month you learned about the signs and symptoms of anxiety and depression, what causes each one, and risk factors. So today we're going to discuss the screening tools for each condition. We're not going to repeat what you learned and heard last month. Both the tools that I'm going to talk about, the generalized anxiety disorder tool, the GAD-7, used to screen for anxiety, and the patient health questionnaire, the PHQ-9, that screens for depression will be presented. These tools I selected, there are many tools available, but these I selected because they can be facilitated and used by anybody, by CNAs, social workers, nurses, and other staff who have been given the education and training to ensure their competency in using these screening tools. They are self-assessment tools. You can take them. Your family members and others can evaluate themselves for anxiety and depression, and both will determine whether a person is experiencing anxiety or depression. And sometimes it's difficult when you think somebody is suffering from depression, and you may find when you use these screening tools that in fact it's anxiety that is their major problem. Next slide. Now, the screening for anxiety, this GAD-7 tool, I like it because it's short and it's very straightforward. It's just the 7 questions. It's self-evaluation, as I mentioned. So if you have somebody who you don't think can self-evaluate, then you would want to select a tool that is used by a clinician and actually used to evaluate an individual. You ask them how they have been feeling over the past 2 weeks. And then the ratings go from 0, not at all, to +3 nearly every day. So the questions, number 1 is, over the past 2 weeks, have you felt nervous, anxious, or on edge? Have you been not been able to stop or control your worrying? Do you think you've been worrying too much about different things? Have you had trouble relaxing? Have you been so restless that it's hard for you to sit still? Have you become easily annoyed or irritable? Are you finding that you just don't have patience and you get annoyed easily? Or are you feeling afraid as if something awful might happen, that feeling of impending doom? Let's go to the next slide. Scoring of the GAD is pretty straightforward. Because it's so brief, all you have to do is add up the score. And when screening for anxiety, a score of 8 or greater represents a reasonable cut point for identifying probable cases of generalized anxiety disorder. So if somebody scores between 0 would be no anxiety, but say between 1 and 4, that would be minimal anxiety. A score of 5 to 9 would be classified as mild anxiety, A score of 10 to 14, moderate anxiety, and a score greater than 15 is severe anxiety. With, remember, the 8 being the cutoff point. So between mild to moderate anxiety. Let's go to the next slide. Okay, the PHQ-9, many of you may be familiar with the PHQ-9 tool. It's used to screen for depression. There are 9 questions, again, self-evaluation. You ask the individual, over the past 2 weeks, have you, and ask them the questions. And the rankings are the same as the GAD. A 0 is not at all, up to nearly every day, which is +3. And the questions include, have you had, over the past 2 weeks, have you found that you have little interest or pleasure in doing things? Have you been feeling down, depressed, or hopeless? Have you had trouble falling asleep, staying asleep, or sleeping too much? Or early morning awakening? Often if people wake up at 3 or 4 in the morning and can't go back to sleep, that is a sign of depression. It can be a sign of depression. Over the past 2 weeks, have you been feeling tired or having little energy? Have you had a poor appetite or are you overeating? Have you lost weight unintentionally? Have you gained weight? Over the past 2 weeks, have you felt bad about yourself or that you're a failure or you've let yourself or your family down? Have you had trouble concentrating on things such as reading the newspaper, reading a book or a magazine, or watching television? Have you been moving or speaking so slowly that other people have noticed and commented on that? Or the opposite, have you been so restless that people have said, hey, can't you sit and relax? Those are all very important things to ask. And number 9 is really critical. Number 9 asks, have you had thoughts that you would be better off dead or of hurting yourself in some way? If the individual says, well, yes, I have been thinking everybody would be better off if I was dead. I have been thinking about killing myself or hurting myself. Then that becomes a mental health emergency. And you need to get them referred for any further evaluation as soon as possible. Contact their primary care provider or whoever is taking care of them in your settings and get them further evaluated. Next slide. The scoring for the PHQ-9, a score of 5 to 9 is considered mild depression, 10 to 14 is moderate depression, 15 to 19 is moderately severe depression, and then a score over 20 is severe depression. The total scores of 5, 10, 15, and 20 represent the cut points for the mild, moderate, moderately severe, and severe depression, respectively. And make sure that number 9, that question about suicide, or I would be better off dead, that rises to a higher level of evaluation immediately. And keep a sitter with the individual until they have been evaluated, and if necessary, take them to an emergency department for a mental health evaluation. Next slide. Now, when you complete these screening tools, make sure that you follow up. With depression, if you have a score that mild depression 5 to 9, you want to do watchful waiting and repeat the screening tool at follow-up, maybe in a week or 2 weeks. A score of 10 to 14, moderate depression. In the treatment plan, consider counseling, follow-up, or pharmacotherapy, medications. Score of 15 to 19, that individual is moderately severe depression. And active treatment is really necessary for this individual with medications, mental health medications, and or psychotherapy or counseling of some type, cognitive behavioral therapy, group therapy, some kind of interaction. And actually for the moderately severely depressed individual, the studies have all shown that treating with the mental health medications such as antidepressants along with counseling has the best outcome of reversing the depression. Then a score greater than 20, the severe depression, that requires immediate initiation of medications, expedited referral to a mental health specialist. So that might be somebody who comes into your facility to do your mental health evaluations, or you may send people out for mental health screening. So another question that I often get asked is, when should we be doing screening for anxiety and depression? Some facilities report that they screen people for depression, at least with some of the questions on admission. Again, I would encourage you to consider using the anxiety and the depression tool to determine if it's anxiety or depression. And if you observe any changes in the resident, such as weight loss or weight gain, or any changes in their activities or their ability to concentrate or participate in activities, that would be a good time to actually do an evaluation and the screening for depression. And remember too that the individual who is moving into a different level of care, even though your facilities are home to them, they may be leaving an area where they had more independence, where they drove a car and now they can't anymore. So it's very important that you recognize that just the fact that they've been moved into a new space could trigger anxiety and depression. Next slide. Okay, substance use disorder. I find this very interesting. 33.5% or 19.4 million adults with mental illness also experienced a substance use disorder. Screening for a substance use disorder should be done on everyone on admission. And one of the reasons you want to do that is to make sure that if they are using substances currently, their medical provider can be notified and put them on medication so that they don't go into withdrawal or that they don't get extremely ill from withdrawal. So often people who have mental illness, including anxiety and depression, will self-medicate with alcohol or recreational drugs, thinking they will make these substances will make them feel better, but in fact, it makes them feel worse. Screening for substance use should be done, as I said, on admission. If they screen positive, notify the provider immediately because that is pretty urgent so that they don't go into withdrawal. And the provider needs to know. Let's go to the next slide. Okay, the CAGE questionnaire has been around for decades, and now it's called CAGE Aid Questionnaire. It's screening for substance use disorder. It's a simple screening to do. It's only 4 questions. It's a self-evaluation. And it's important that you ask them to think about lifetime use of illegal drugs or prescription drugs, using them beyond the time that they're supposed to use them, such as painkillers, opioids, post-surgery, or if they're taking somebody else's prescriptions, or if they are taking prescription drugs for reasons other than what they were prescribed for. And the ranking is very simple. It's simply yes or no. Yes, I have done this, or no, I don't. So the questions, the C is, have you ever felt that you ought to cut down on your drinking or drug use? The C is cut down. A is annoyed. Have people annoyed you by criticizing your drinking or drug use? G is guilty. Have you ever felt bad or guilty about your drinking or drug use? And E is an eye opener. Have you ever had a drink or used drugs first thing in the morning to steady your nerves or to get rid of a hangover? The eye opener. And as I said, if they score yes on these, they have a positive screening for a substance use disorder. Then you would need to find out if they currently are using and what they are using, or if their use is in the past. And if so, have they participated in any kind of therapy or AA or Narcotics Anonymous? And if so, if they have, are they currently in groups like that? And if they are, then you want to look at how you could continue that treatment for them. Okay, now There is a really good reference that is on the Center of Excellence for Behavioral Health and Nursing in nursing facilities on the Alliant Health website, and it's called Guide for Substance Use Screening in Nursing Facilities. And this is a great 3-page tool that you can use to walk through why to screen for substance use in a nursing facility, how to plan a screening program, when to screen, substance use screening guides, and this actually goes over the CAGE tool that's right here in front of us. If current substance use is suspected, what should you do? And then the different screening tools, which, as I just said, the CAGE AIDS substance abuse screening tool is also, the link is also on this document. So I would highly recommend that if you haven't read that or had access to that, that you access that. Let's go to the next slide. Okay, and one other question that people ask is, can a CNA really do this, the screening? And my response is yes. They can screen themselves. They can have family members screen themselves, but you really need to teach them how to do it and have them practice. Have them practice on their coworkers and ensure that they have competencies, just like you do most things that CNAs participate in, or any of your staff, nurses, social workers. You want to make sure that they're comfortable asking those giving the self-evaluation tool, and then if the individual answers yes to something like suicidal ideation, they then know what to do because they can't just ignore that. Okay, so that concludes my little brief little presentation on some of the, an example of screening tools for each of the areas, and I'm going to turn it back over to Sarah.